Welcome to the CCMA Full Practice Test 1. This quiz contains 100 questions to help you prepare for the CCMA Full exam. Let's get started. Question 1. What does at-will employment mean in the context of a medical assistant's employment relationship? Option A. The employer must provide a written contract specifying the duration of employment. Option B. Either the employer or the employee may terminate the employment relationship at any time for any legal reason without advance notice. Option C. The employee can only be terminated for documented performance issues after a formal review process. Option D. Employment continues indefinitely unless the employee violates specific workplace policies listed in the handbook. The correct answer is B. At-will employment is the default employment relationship in most U.S. states, meaning either party may end the employment at any time without cause or notice. This is the standard for most healthcare positions unless a specific contract or union agreement modifies it. Medical assistants should understand this fundamental employment principle. Question 2. When administering medication to a patient, which of the following represents the correct sequence of the 6 rights of medication administration? Option A. Right patient, right medication, right dose, right route, right time, right documentation. Option B. Right medication, right patient, right dose, right time, right route, right documentation. Option C. Right patient, right dose, right medication, right time, right route, right documentation. Option D. Right patient, right medication, right route, right dose, right time, right documentation. The correct answer is A. The 6 rights of medication administration are a fundamental safety protocol that must be followed in sequence to prevent medication errors. The standard order begins with verifying the right patient, followed by confirming the right medication, dose, route, time, and finally documenting administration. Question 3. A medical assistant is rooming a new patient, Mr. James Chin, for a scheduled appointment. Before proceeding with vital signs measurement, which patient identification protocol should the medical assistant follow? Option A. Ask the patient to state their full name and compare it to the appointment schedule. Option B. Verify the patient's date of birth by asking them to state it aloud and confirm with the chart. Option C. Ask the patient to state their full name and verify their date of birth using 2 separate identifiers. Option D. Check the patient's wristband if present and compare the name to the appointment schedule. The correct answer is C. Patient identification must use 2 separate identifiers before any clinical procedure, including vital signs measurement. The standardized protocol requires the patient to state their full name and date of birth, which the medical assistant verifies against the medical record or appointment schedule. This 2-identifier protocol is a patient safety standard that prevents misidentification and ensures the correct patient receives care. Never use room numbers or bed numbers as identifiers. Question 4. A medical assistant is labeling a urine specimen that will be sent to a reference laboratory for culture and sensitivity testing. Which information must be included on the specimen label to ensure proper processing and accurate results? Option A. Patient's full name, date of birth, and the medical assistant's signature. Option B. Patient's full name, date of birth, date and time of collection, and type of specimen. Option C. Patient's room number and the provider's name only. Option D. Patient's diagnosis and the tests ordered written in medical terminology. The correct answer is B. Proper specimen labeling is essential for accurate laboratory processing and patient safety. Required elements include patient identifiers, name, date of birth, collection information, date and time, and specimen type. This information ensures proper patient identification, maintains chain of custody, and allows the laboratory to process the specimen according to appropriate protocols for that specimen type. Question 5. A medical assistant is educating a patient with newly diagnosed type 2 diabetes about dietary modifications. After explaining the recommended carbohydrate intake and meal timing, which action should the medical assistant take to verify the patient's understanding? Option A. Ask the patient if they have any questions about the diet instructions. Option B. Request that the patient explain the diet plan back in their own words. Option C. Provide written handouts about diabetic meal planning for the patient to review at home. Option D. Tell the patient to call the office if they have difficulty following the diet. The correct answer is B. The teach-back method is the gold standard for verifying patient understanding of health information. By asking the patient to explain the information in their own words, the medical assistant can identify gaps in comprehension and clarify misconceptions immediately. This technique is particularly important for complex conditions like diabetes, where adherence directly affects health outcomes. Simply asking if the patient has questions, option A, often yields false reassurance, as patients may feel embarrassed to admit confusion. Question 6. When assessing a patient's respiratory rate, which of the following is the correct technique to obtain an accurate measurement? Option A. Inform the patient that you are counting their breaths, then count for 30 seconds. Option B. Count respirations while appearing to continue taking the pulse for a full 60 seconds. Option C. Ask the patient to breathe normally and count for 15 seconds, then multiply by 4. Option D. Observe the chest for movement and count only visible chest rises for 30 seconds. The correct answer is B. Respiratory rate is easily influenced by conscious awareness. Patients may voluntarily alter their breathing pattern when they know it is being measured. The standard technique involves continuing to hold the patient's wrist after pulse measurement, appearing to still count the pulse, while actually observing respirations. A full 60-second count is recommended for accuracy, especially if the respiratory pattern appears irregular. Question 7. A medical assistant is obtaining vital signs on Mrs. Gable, an 82-year-old patient who lives alone and takes multiple medications, including a beta blocker for hypertension. The patient's radial pulse is 58 beats per minute, regular rhythm. Her blood pressure is 128/76 mmHg, and she reports feeling fine with no dizziness or fatigue. Which of the following actions is most appropriate? Option A. Immediately notify the provider that the patient has bradycardia and may need medication adjustment. Option B. Document the pulse as 58 BPM. Note the patient is asymptomatic and recognize this may be expected with beta blocker therapy. Option C. Instruct the patient to stop taking her beta blocker until she sees the provider. Option D. Repeat the pulse measurement 3 times to confirm the reading before documenting. The correct answer is B. Beta blockers work by blocking sympathetic stimulation of the heart, which intentionally lowers heart rate and blood pressure. A resting heart rate of 58 BPM in an asymptomatic patient on beta blocker therapy is often an expected therapeutic effect. The medical assistant should document the finding accurately, include the asymptomatic status, and recognize the medication context. Geriatric patients often have lower baseline heart rates due to age-related changes and medications. Question 8. A medical assistant is explaining fasting requirements to a patient scheduled for a lipid panel blood test. The patient appears confused when the medical assistant says, "You need to fast for 12 hours prior to the venipuncture, so nothing by mouth except water after midnight." Which of the following is the most appropriate modification to ensure patient understanding? Option A, repeat the same instruction louder and more slowly so the patient can hear and process it better. Option B, simplify to don't eat or drink anything except plain water after midnight tonight. Come in tomorrow morning for your blood test before you eat breakfast. Option C, write down the technical instruction exactly as stated and hand it to the patient to read at home. Option D, ask the patient if they understand medical terminology and proceed if they confirm comprehension. The correct answer is B. When a patient appears confused, the medical assistant should adapt communication to the patient's health literacy level by replacing technical terms, fast, venipuncture, nothing by mouth, with plain language. This simplified version conveys the same information in everyday terms that any patient can understand. Question 9. A medical assistant is preparing to perform an EKG on a patient who has a bilateral below-knee amputation. How should the limb leads be placed? Option A. Place the leg electrodes on the patient's residual limbs at the same relative distance from the torso. Option B. Skip the leg leads and perform only a 6-lead EKG. Option C. Place the leg electrodes on the patient's lower abdomen or upper thighs. Option D. Use the arm electrodes for all 4 limb lead positions. The correct answer is C. For patients with lower limb amputations, the leg electrodes, LL and RL, should be placed on the lower abdomen or upper thighs at the same relative distance from the heart as the standard ankle placement would be. This maintains the Enthoven triangle configuration and ensures accurate limb lead readings while accommodating the patient's anatomy. Question 10. A certified clinical medical assistant, CCMA, primarily works in which type of healthcare setting? Option A, inpatient hospital units. Option B, ambulatory and outpatient care facilities. Option C, emergency departments. Option D, long-term nursing facilities. The correct answer is B. The CCMA credential is specifically designed for medical assistants working under the supervision of licensed healthcare providers in ambulatory and outpatient care settings. These include physician offices, group practices, specialty clinics, urgent care centers, outpatient surgery centers, and community health centers. The CCMA scope of practice is tailored to the workflow and patient population of these settings. Question 11. A 4-year-old child is brought to the pediatric clinic by his mother for a well-child visit. The child is due for multiple vaccinations including DTaP, IPV, and MMR. The child is visibly anxious, crying, and clinging to his mother. He has a history of fainting during needle procedures. The medical assistant has prepared the vaccines and verified the 5 rights of medication administration. What is the most appropriate sequence of actions for the medical assistant to take? Option A. Restrain the child on the examination table, administer all 3 vaccines rapidly in different limbs, then allow the mother to comfort the child. Option B. Have the mother hold the child in a comfortable position, use age-appropriate distraction techniques, administer vaccines one at a time with brief pauses, and observe the child for 15 minutes post-vaccination. Option C. Apply a topical anesthetic cream, wait 30 minutes for it to take effect, then administer all vaccines while the child is lying supine. Option D. Explain the procedure in detail to the child, emphasizing the importance of vaccines, then administer all 3 vaccines quickly to minimize the overall procedure time. The correct answer is B. For a pediatric patient with anxiety and history of fainting, the priority is minimizing trauma while ensuring safety. Having the parent hold the child provides comfort and security. Distraction techniques, toys, bubbles, videos are age-appropriate coping strategies. Administering vaccines one at a time with pauses allows the child to recover between injections. Post-vaccination observation is critical given the syncope history to prevent injury from fainting. Question 12. A medical assistant is caring for Mr. Rodriguez, a 45-year-old male with a history of hypertension, who presents for a routine follow-up. During vital sign assessment, the medical assistant notes the following: radial pulse rate 88 BPM, irregular rhythm, weak strength. The patient reports feeling heart skips occasionally. What should the medical assistant do first? Option A. Immediately notify the provider of the irregular rhythm. Option B. Obtain an apical pulse to accurately assess the heart rate. Option C. Document the findings and continue with the remaining vital signs. Option D. Reassess the radial pulse for a full 60 seconds to confirm the finding. The correct answer is B. The first priority is to obtain accurate cardiac assessment data. The radial pulse shows irregular rhythm with weak strength, suggesting possible arrhythmia with pulse deficit. The apical pulse provides the true heart rate by capturing all cardiac contractions. This data is essential before notifying the provider, as the comparison between apical and radial rates provides clinically significant information, pulse deficit, that guides provider decision-making. Question 13. Which of the following examination positions is used primarily for rectal examinations, enema administration, and sigmoidoscopy procedures? Option A. Fowler's position. Option B. Lithotomy position. Option C. Sims position. Option D. Knee chest position. The correct answer is C. Sims position, also called left lateral recumbent position, is the standard position for rectal examinations, enema administration, and sigmoidoscopy procedures. In this position, the patient lies on their left side with the left arm behind the body, the right knee drawn up toward the chest, and the left leg extended or slightly bent. This position provides optimal access to the rectal area while maintaining patient comfort and dignity. Question 14. Which component of the EKG tracing represents ventricular depolarization? Option A. P wave. Option B. T wave. Option C. QRS complex. Option D. U wave. The correct answer is C. The QRS complex represents ventricular depolarization, the electrical activation of the ventricles before they contract. This is typically the largest and most visible waveform on the EKG tracing because the ventricles have the greatest muscle mass. Understanding wave components is essential for basic rhythm interpretation. Question 15. A medical assistant is assisting a provider with administering antibiotic ear drops to a 5-year-old child for otitis media. Which positioning technique should the medical assistant use for proper ear drop administration in a pediatric patient? Option A. Pull the ear pinna upward and backward. Option B. Pull the ear pinna downward and backward. Option C. Pull the ear pinna upward and forward. Option D. Pull the ear pinna downward and outward. The correct answer is B. For children under age 3, the ear canal is directed more upward than in adults. To straighten the ear canal and allow drops to flow properly, the pinna should be pulled downward and backward. This positioning aligns the ear canal for optimal medication delivery. The drops should be instilled along the side of the canal, not directly onto the tympanic membrane. Question 16. A medical assistant is measuring a patient's blood pressure and uses a cuff that is too small for the patient's arm size. The reading shows an elevated blood pressure, and the provider prescribes an antihypertensive medication based on this inaccurate reading. Which legal concept applies to the medical assistant's action? Option A, intentional tort. Option B, negligence due to failure to meet standard of care. Option C, criminal assault. Option D, invasion of privacy. The correct answer is B. The standard of care for blood pressure measurement includes selecting an appropriately sized cuff. Using an incorrectly sized cuff violates this standard, potentially causing patient harm through inappropriate treatment. This constitutes negligence, not an intentional act, but a failure to meet professional standards. Question 17. A medical assistant is preparing to perform venipuncture on a 68-year-old patient with fragile veins. The patient mentions she had a mastectomy on her left side 2 years ago. Which arm should the medical assistant select for the venipuncture procedure? Option A, left arm, avoiding the antecubital area. Option B, right arm, using the median cubital vein. Option C, either arm, as the mastectomy is no longer relevant. Option D, left arm, using the basilic vein. The correct answer is B. Following a mastectomy, the affected side has altered lymphatic drainage and increased risk of infection, lymphedema, and impaired circulation. Venipuncture should always be performed on the opposite arm to prevent complications. The median cubital vein in the antecubital fossa is the preferred first choice for venipuncture due to its size, stability, and accessibility. Question 18. A medical assistant accidentally draws a lavender tube before a light blue tube when collecting specimens for a PT/INR and CBC. What is the most likely consequence of this error? Option A, the CBC results will be elevated. Option B, the PT/INR results will be falsely elevated. Option C, both tests will produce accurate results. Option D, the blood specimen will clot in both tubes. The correct answer is B. Drawing the lavender tube containing EDTA before the light blue tube containing sodium citrate can cause EDTA carryover into the light blue tube. EDTA is a stronger anticoagulant than sodium citrate and binds calcium more completely. This calcium binding can interfere with the coagulation cascade, causing the PT/INR to appear longer than it actually is. A falsely elevated result that could lead to incorrect clinical decisions about the patient's anticoagulation therapy. Question 19. A 4-year-old male patient presents to the pediatric clinic for a sick visit. His mother reports he has been irritable and eating poorly. The medical assistant needs to obtain the child's temperature. Which route and technique is most appropriate? Option A, oral temperature with the child seated and thermometer under tongue for 30 seconds. Option B, tympanic temperature with the ear pulled downward and backward. Option C, temporal artery temperature with a gentle sweep across the forehead. Option D, rectal temperature with the child in Sims position. The correct answer is C. For a 4-year-old child, the temporal artery route is ideal because it is non-invasive, quick, well tolerated by young children who may be anxious or uncooperative, and provides accurate readings. The technique involves gently sweeping the thermometer across the forehead to capture the temporal artery temperature, which correlates well with core temperature in pediatric patients. Question 20. A medical assistant is setting up a sterile field for a minor surgical procedure. While opening a sterile package, the assistant accidentally touches the inside of the package with an ungloved hand. What action should the assistant take? Option A, continue setting up the field since only one item was contaminated. Option B, remove the contaminated item and use the remaining sterile items. Option C, discard the entire package and obtain a new sterile supply. Option D, apply sterile gloves and continue using the package contents. The correct answer is C. Once the inside of a sterile package is touched with an ungloved hand, the sterility of that package is compromised. The entire contents must be considered contaminated and discarded. Sterile technique requires that only sterile items contact sterile items. Attempting to salvage remaining items or continuing with contaminated supplies violates surgical asepsis principles and poses infection risk. Question 21. A medical assistant works in a pediatric oncology clinic where she regularly interacts with children with serious illnesses and their families. To maintain her emotional well-being and prevent compassion fatigue, which self-care strategy is most effective when practiced consistently? Option A. Avoiding emotional connections with patients to protect herself from distress. Option B. Establishing clear professional boundaries while maintaining empathy and engaging in regular stress reduction activities outside of work. Option C. Working extra hours to stay busy and avoid thinking about difficult cases. Option D. Discussing detailed patient cases with friends and family to process emotions. The correct answer is B. Effective self-care in high-stress clinical environments requires a balance between maintaining professional empathy and establishing boundaries that prevent emotional overwhelm. Regular stress reduction activities, exercise, meditation, hobbies, social connections outside of work provide emotional restoration and help healthcare workers maintain resilience. This approach preserves the ability to provide compassionate care while protecting personal well-being. Question 22. A 52-year-old patient presents for an annual wellness visit. The patient has no current complaints and is up to date on most screenings. According to preventive care guidelines, which age-appropriate screening should the medical assistant ensure is discussed with the provider during this visit? Option A. Mammography referral for breast cancer screening. Option B. Colonoscopy scheduling for colorectal cancer screening. Option C. Bone density scan for osteoporosis screening. Option D. Prostate-specific antigen, PSA, testing discussion. The correct answer is B. Colorectal cancer screening is recommended for all adults starting at age 45 to 50, depending on the guideline used. At age 52, this patient is due for colorectal cancer screening if not completed recently. The medical assistant should ensure this preventive service is addressed during the wellness visit. Question 23. A medical assistant is conducting a phone follow-up with a patient who has type 2 diabetes and has not been filling their metformin prescription. The patient states, "I know I need to take it, but I just can't afford it right now. I had to choose between my medication and paying my electric bill." The patient also mentions they don't have reliable transportation to get to the pharmacy. Which resources and interventions should the medical assistant consider to address these barriers? Option A. Tell the patient to take the medication as prescribed and explain the serious complications of uncontrolled diabetes. Option B. Document the patient's statement in the chart and inform the provider at the next scheduled visit in 3 months. Option C. Assess for prescription assistance programs, generic alternatives, pharmacy delivery services, and community resources. Collaborate with social work if available, and schedule earlier follow-up. Option D. Advise the patient to go to the emergency department if they experience symptoms of high blood sugar. The correct answer is C. The medical assistant should address social determinants of health, cost, transportation that are barriers to medication adherence. This includes exploring prescription assistance programs, manufacturer coupons, generic alternatives, pharmacy delivery or mail-order options, and community resources, transportation services, utility assistance. Collaboration with social work and scheduling earlier follow-up demonstrates proactive care coordination. Question 24. You are collecting blood specimens from a 3-year-old pediatric patient for a complete blood count and lead screening. The child is anxious and crying, and the parent is holding the child securely in your lap. The child's antecubital veins are small and difficult to visualize, but you can palpate a suitable vein. The provider has specifically ordered tests that require EDTA, lavender top, and trace element-free collection. Given the patient's age, clinical presentation, and test requirements, which collection method and tube selection is most appropriate? Option A. Venipuncture using a 23-gauge butterfly needle into the antecubital vein, filling a standard lavender, EDTA, tube and a red, no additive, tube. Option B. Capillary puncture using a 2.0 mm depth lancet on the lateral or medial plantar surface of the heel, filling a pediatric EDTA microtainer and trace element-free microtainer. Option C. Capillary puncture using a 2.0 mm depth lancet on the middle finger of the non-dominant hand, filling a pediatric EDTA microtainer and trace element-free microtainer. Option D. Venipuncture using a 21-gauge straight needle into the cephalic vein, filling a standard lavender, EDTA, tube and a royal blue, trace element, tube. The correct answer is B. For pediatric patients under 2 years of age, and often up to 3 years when veins are difficult, capillary puncture is preferred over venipuncture when only small volumes are needed. The correct site for infants and young children is the lateral or medial plantar surface of the heel, never the posterior curvature, arch, or central area due to risk of bone injury. A 2.0 mm depth lancet is appropriate for this age. Pediatric microtainers are designed for capillary collection and require smaller volumes. Trace element testing requires special trace element-free tubes to prevent contamination. Question 25. A medical assistant is preparing to administer an influenza vaccine via intramuscular injection to a healthy adult patient. After performing hand hygiene and verifying patient identity, the medical assistant notices that the safety-engineered needle device has a visible defect in the safety shield mechanism. What should the medical assistant do? Option A. Proceed with the injection using careful technique, then dispose of the device in the sharps container. Option B. Activate the safety mechanism after the injection to test whether it functions properly. Option C. Obtain a replacement safety-engineered device before proceeding with the injection. Option D. Use a non-safety needle device from the backup supply to complete the vaccination. The correct answer is C. OSHA requires the use of safety-engineered sharps devices whenever available. If a safety device has a visible defect or malfunction, the medical assistant should not use that device. Obtaining a functioning safety-engineered replacement is the appropriate action to maintain compliance with sharps injury prevention standards while ensuring patient care continues safely. Question 26. A patient's insurance explanation of benefits, EOB, shows that a $200 claim was processed with a $50 deductible applied and $30 coinsurance at 20%. What amount is the patient responsible to pay? Option A, $50 only. Option B, $80. Option C, $200. Option D, $30. The correct answer is B. The patient's responsibility is calculated by adding the deductible, $50, plus the coinsurance amount. Coinsurance of 20% means the patient pays 20% of the remaining balance after the deductible. The remaining balance is $200 to $50 equals $150, and 20% of $150 equals $30. Total patient responsibility equals $50 deductible plus $30 coinsurance equals $80. Question 27. A medical assistant is performing venipuncture when the patient begins to feel dizzy and nauseated. The patient's face appears pale and clammy. What should the medical assistant do first? Option A. Complete the blood draw quickly to finish the procedure. Option B. Release the tourniquet, remove the needle, and lower the patient's head. Option C. Ask the patient to stand up and walk around. Option D. Continue the draw while calling for assistance. The correct answer is B. These symptoms indicate syncope, fainting, or near syncope, a common vasovagal response to venipuncture. The first priority is patient safety. Release the tourniquet to restore circulation, remove the needle to prevent injury if the patient moves, and lower the patient's head, or have them lie down, to improve cerebral blood flow. Continuing the draw risks needle injury, hematoma, or patient fall. Question 28. A medical assistant develops a chronic back condition that limits the ability to stand for extended periods. The employee requests a sit-stand workstation and modified patient rooming schedule. What is the employer's first step in the ADA accommodation process? Option A. Immediately approve the requested accommodations without any discussion or documentation. Option B. Deny the request because the medical assistant job inherently requires standing for patient care. Option C. Engage in an interactive process with the employee to assess the limitations, discuss possible accommodations, and determine what would enable the employee to perform essential job functions. Option D. Require the employee to provide a complete medical history and all diagnostic test results before considering any accommodation. The correct answer is C. The ADA requires employers to engage in an interactive process with employees requesting accommodations. This collaborative dialogue identifies the employee's limitations, explores potential accommodations, and determines which accommodations are reasonable and effective. The process involves both employer and employee working together to find solutions. Question 29. What does the medical abbreviation PRN indicate when written in a medication order? Option A. Administer the medication every morning. Option B. Administer the medication as needed by the patient. Option C. Administer the medication before meals. Option D. Administer the medication twice daily. The correct answer is B. The abbreviation PRN stands for the Latin phrase pro re nata, which translates to as needed or as the situation arises. When a medication order includes PRN, it indicates that the medication should be given only when the patient requires it for a specific condition, rather than at scheduled times. This is commonly used for medications like pain relievers, antipyretics, or antiemetics. Question 30. Which type of medication container is specifically designed to protect light-sensitive medications from degradation? Option A. Clear glass vial with plastic cap. Option B. Amber, brown, glass bottle or container. Option C. White opaque plastic bottle. Option D. Aluminum foil blister pack. The correct answer is B. Amber or brown glass containers are specifically designed to filter out ultraviolet and visible light wavelengths that can cause photochemical degradation of light-sensitive medications. Many medications, including certain antibiotics, cardiovascular drugs, and vitamins, degrade when exposed to light. Amber glass provides the most effective protection against photodegradation compared to other container types. Question 31. A provider orders a fasting glucose test for a patient. Which blood collection tube should the medical assistant use for this specimen? Option A. Light blue top tube. Option B. Red top tube. Option C. Lavender top tube. Option D. Gray top tube. The correct answer is D. The gray top tube contains sodium fluoride and potassium oxalate. Sodium fluoride acts as an antiglycolytic agent that prevents the breakdown of glucose by cellular enzymes in the blood specimen. This preserves glucose levels for accurate measurement, making the gray tube the preferred choice for glucose testing, especially when there may be a delay between collection and analysis. Question 32. Before performing a 12-lead EKG, the medical assistant prepares the patient's skin at each electrode site. Which sequence of skin preparation steps is correct? Option A. Apply electrode gel, shave if needed, clean with alcohol, allow to dry. Option B. Clean with alcohol, shave if needed, lightly abrade with gauze, allow to dry. Option C. Lightly abrade with gauze, clean with alcohol, shave if needed, apply electrodes. Option D. Shave if needed, apply electrode gel, clean with alcohol, place electrodes immediately. The correct answer is B. Proper skin preparation follows this sequence. Clean the area with an alcohol wipe to remove oils and dirt. Shave excess hair if necessary. Lightly abrade the skin with dry gauze to remove dead skin cells. And allow the area to dry completely before applying electrodes. This sequence ensures optimal electrical conductivity and electrode adhesion. Question 33. After completing a wound care procedure on a patient with a methicillin-resistant Staphylococcus aureus (MRSA) infection, the medical assistant needs to remove personal protective equipment. What is the correct sequence for doffing PPE? Option A. Gloves, gown, goggles, mask. Option B. Gown, gloves, mask, goggles. Option C. Gloves, goggles, gown, mask. Option D. Mask, goggles, gown, gloves. The correct answer is C. The correct PPE doffing sequence follows the principle of removing the most contaminated items first while minimizing cross-contamination. Gloves are typically the most contaminated because they directly contact the patient and infectious materials, so they are removed first. Goggles are removed next, followed by the gown, which may have contamination on the front and sleeves, and finally the mask, which is considered cleaner because it only contacted the wearer's face and filtered air. Hand hygiene must be performed immediately after glove removal and again after complete PPE removal. Question 34. What is the key difference between a benign tumor and a malignant tumor? Option A. Benign tumors are larger than malignant tumors. Option B. Benign tumors remain localized. Malignant tumors can metastasize. Option C. Benign tumors cause pain. Malignant tumors are painless. Option D. Benign tumors require surgery. Malignant tumors require chemotherapy. The correct answer is B. The defining characteristic distinguishing benign from malignant neoplasms is the ability to metastasize, spread to other body sites. Benign tumors grow slowly, remain encapsulated, and do not invade surrounding tissues or spread to distant sites. Malignant tumors grow rapidly, invade surrounding tissue, and can metastasize through blood or lymphatic systems. Question 35. A patient receives an intramuscular injection of an antibiotic in the clinic. 15 minutes after the injection, the patient reports feeling dizzy and states, "My throat feels tight, and I'm having trouble breathing." The medical assistant notes hives on the patient's arms and face. What type of medication reaction is this patient experiencing? Option A. Expected side effect. Option B. Mild adverse reaction. Option C. Anaphylactic reaction. Option D. Idiosyncratic reaction. The correct answer is C. The patient is experiencing signs of anaphylaxis, a severe, life-threatening allergic reaction that requires immediate emergency intervention. Key indicators include rapid onset, within minutes of exposure, respiratory distress, throat tightness, difficulty breathing, cardiovascular symptoms, dizziness suggesting hypotension, and cutaneous manifestations, hives. This is a medical emergency requiring immediate activation of emergency response and administration of epinephrine if available. Question 36. Which defense mechanism involves attributing one's own unacceptable thoughts or feelings to another person? Option A, denial. Option B, projection. Option C, rationalization. Option D, displacement. The correct answer is B. Projection is a defense mechanism in which an individual unconsciously attributes their own unacceptable thoughts, feelings, or impulses to another person. For example, a patient who is angry with their provider might accuse the provider of being hostile toward them. Recognizing projection helps the medical assistant maintain therapeutic communication without becoming defensive. Question 37. Which of the following best defines the difference between medical asepsis and surgical asepsis? Option A. Medical asepsis eliminates all microorganisms, while surgical asepsis only reduces their numbers. Option B. Medical asepsis reduces the number of microorganisms, while surgical asepsis eliminates all microorganisms including spores. Option C. Medical asepsis is used for minor procedures, while surgical asepsis is only used in operating rooms. Option D. Medical asepsis requires sterilization, while surgical asepsis requires only disinfection. The correct answer is B. Medical asepsis, clean technique, aims to reduce the number of microorganisms to prevent transmission of infection, but does not eliminate all organisms. Surgical asepsis, sterile technique, aims to completely eliminate all microorganisms, including bacterial spores, to maintain a sterile field. This fundamental distinction guides infection control practices in clinical settings. Question 38. A medical assistant is assisting with a minor surgical procedure in the treatment room. The provider accidentally contaminates a sterile instrument by touching a non-sterile surface. Which of the following actions should the medical assistant take? Option A. Wipe the instrument with alcohol and return it to the sterile field. Option B. Remove the instrument from the sterile field and replace it with a sterile one. Option C. Continue using the instrument since only a small area was contaminated. Option D. Notify the provider after the procedure is completed. The correct answer is B. When any item on a sterile field becomes contaminated, it must be immediately removed and replaced with a sterile item. Sterile technique requires maintaining asepsis throughout the procedure, and any breach of the sterile field compromises patient safety and increases infection risk. Alcohol wiping does not sterilize an instrument, it only disinfects. Using a contaminated instrument or delaying notification until after the procedure would violate sterile technique principles and potentially harm the patient. Question 39. Which blood collection tube is appropriate for collecting a specimen for a comprehensive metabolic panel, CMP? Option A, light blue top tube. Option B, red or gold top tube. Option C, lavender top tube. Option D, gray top tube. The correct answer is B. Red top tubes, plain tubes with no additive, or gold top tubes, serum separator tubes with clot activator and gel separator, are used for serum chemistry tests including comprehensive metabolic panels. The CMP includes glucose, electrolytes, kidney function tests, and liver function tests, all of which require serum, which is obtained after blood clots and is centrifuged. The gold tube's gel separator creates a physical barrier between serum and cells, maintaining specimen integrity. Question 40. A medical assistant is reviewing the medication list of an 82-year-old patient who will be undergoing a minor procedure. The patient takes warfarin, metformin, lisinopril, and ibuprofen daily. Which of the following medications should the medical assistant report to the provider as a potential concern before the procedure? Option A, metformin and lisinopril only. Option B, warfarin and ibuprofen only. Option C, all 4 medications equally. Option D, none of the medications require reporting. The correct answer is B. Warfarin is an anticoagulant that increases bleeding risk during procedures and may need to be held or adjusted beforehand. Ibuprofen is an NSAID that also affects platelet function and increases bleeding risk. Both medications require provider evaluation before any procedure. Metformin and lisinopril typically do not require adjustment for minor procedures. Question 41. A physician orders a bilateral chest X-ray for a patient with respiratory symptoms. Which anatomical location does this term indicate? Option A, only the left side of the chest. Option B, only the right side of the chest. Option C, both sides of the chest. Option D, the center of the chest only. The correct answer is C. The prefix bi- means to or both, and the root lateral refers to side. Bilateral, therefore, indicates affecting, involving, or imaging both sides of the body or organ. In the context of a chest X-ray, a bilateral order means both the left and right sides of the chest will be imaged, allowing comparison of both lungs for conditions like pneumonia, effusions, or other abnormalities. Question 42. Which of the following best describes the purpose of using the teach-back method when documenting patient education in the electronic health record? Option A, to test the patient's intelligence and cognitive abilities. Option B, to verify that the patient understood the information provided before documenting education completion. Option C, to make the patient feel embarrassed if they did not understand the instructions. Option D, to replace written instructions with verbal instruction only. The correct answer is B. The teach-back method is a patient education verification technique where the healthcare provider asks the patient to repeat back or demonstrate understanding of the information provided. This ensures comprehension before documenting that education was completed and is especially important for patients with varying health literacy levels. Question 43. A medical assistant is assisting a provider with a minor surgical procedure to remove a sebaceous cyst on a patient's back. During the procedure, the medical assistant accidentally cuts her glove on a contaminated scalpel blade, sustaining a small puncture wound on her index finger. The procedure was being performed on a patient whose HIV status is unknown. What should the medical assistant do first in this situation? Option A, complete the surgical procedure while maintaining sterile technique before addressing the injury. Option B, remove the contaminated glove, wash the wound with soap and water, and report the incident immediately. Option C, apply pressure to the wound with a sterile gauze and continue assisting with the procedure. Option D, document the incident in the patient's medical record and schedule follow-up testing. The correct answer is B. OSHA blood-borne pathogen exposure protocols require immediate action when a percutaneous exposure occurs. The medical assistant must stop participation in the procedure, remove the contaminated glove, wash the wound thoroughly with soap and water for at least 15 seconds, and immediately report the incident to the supervisor for proper documentation and post-exposure prophylaxis evaluation. This prioritizes the medical assistant's safety and ensures proper medical evaluation can begin promptly. Question 44. A medical assistant is working in a busy primary care clinic. The physician asks the MA to coordinate care for a patient who needs referrals to a cardiologist and a dietitian. What is the most appropriate first step the medical assistant should take in this referral process? Option A. Call both specialists immediately to schedule appointments. Option B. Verify the patient's insurance coverage and referral requirements. Option C. Provide the patient with a list of in-network providers to choose from. Option D. Document the referral request in the patient's chart and wait for follow-up. The correct answer is B. Before scheduling any referrals, the medical assistant must verify insurance coverage and determine if pre-authorization is required. Many insurance plans require prior authorization for specialist visits, and failing to obtain this can result in claim denials and unexpected costs for the patient. This step ensures the referral process proceeds smoothly without financial barriers. Question 45. A medical assistant is selecting a vein for venipuncture on an elderly patient with fragile veins. Which vein characteristic should the medical assistant avoid when making the selection? Option A. A vein that feels bouncy and resilient when palpated. Option B. A vein that appears straight and runs parallel to the forearm. Option C. A vein that feels hard, cord-like, and lacks elasticity. Option D. A vein that is well anchored and does not roll when touched. The correct answer is C. A vein that feels hard, cord-like, and lacks elasticity indicates sclerosis, scarring, from previous venipunctures or IV therapy. Sclerosed veins are difficult to penetrate, may not yield adequate blood flow, and are more prone to complications. The medical assistant should avoid these veins and select a site that feels soft, bouncy, and resilient. Question 46. A patient needs to be positioned for a rectal examination and enema administration. Which position places the patient on their left side with the right knee flexed toward the chest and the left arm extended behind the body? Option A. Knee-chest position. Option B. Sims position. Option C. Lithotomy position. Option D. Dorsal recumbent position. The correct answer is B. Sims position, also called the left lateral position, is the standard position for rectal examinations, enema administration, sigmoidoscopy, and rectal temperature measurement. The patient lies on their left side with the right knee drawn up toward the chest, the left arm extended behind the body, and the right arm placed comfortably in front. This position provides optimal visualization and access to the rectal area. Question 47. A 58-year-old male patient, Mr. Anderson, presents for a follow-up visit for hypertension management. He reports taking his medications as prescribed. His vital signs today are BP 142/88 mmHg, right arm, seated, pulse 72 BPM, respiration 16 per minute, temperature 98.6 degrees Fahrenheit 37.0 degrees Celsius. Last visit, his blood pressure was 128/82 mmHg in the left arm. He states he had 2 cups of coffee this morning and smoked a cigarette 15 minutes before arriving. His bladder is visibly full, and he mentions he needs to use the restroom. Which factor is least likely to be contributing to his elevated blood pressure reading today? Option A. Recent caffeine consumption, 2 cups of coffee. Option B. Recent nicotine exposure, cigarette 15 minutes ago. Option C. Full bladder causing discomfort and sympathetic stimulation. Option D. Using the right arm instead of the left arm for measurement. The correct answer is D. while there can be small interarm blood pressure differences typically. Question 48. A 28-year-old female patient presents to the clinic with complaints of increased thirst, frequent urination, and unexplained weight loss over the past 3 weeks. Her random capillary blood glucose reading is 342 milligrams per deciliter. The provider orders a hemoglobin A1C, fasting blood glucose, and basic metabolic panel. After confirming the elevated glucose, you educate the patient about the results. She asks you what her blood glucose reading means and whether she has diabetes. What is the most appropriate response within the CCMA scope of practice? Option A. Explain that her blood glucose is significantly elevated and consistent with diabetes, and she will need to start insulin immediately. Option B. Inform the patient that her glucose is high, but avoid interpreting results or providing a diagnosis. Explain that the provider will review all results and discuss the diagnosis and treatment plan. Option C. Tell the patient that her glucose is above the normal range of 70 to 100 mg/dl and suggest she start exercising and reducing carbohydrate intake. Option D. Reassure the patient that stress can cause temporary glucose elevation and recommend she return for a repeat test in 2 weeks before making any conclusions. The correct answer is B. Medical assistants must work within their scope of practice, which excludes diagnosing conditions or prescribing treatment. While the glucose reading is clearly elevated, providing a diagnosis or treatment recommendations exceeds CCMA scope. The appropriate response acknowledges the abnormal result while deferring diagnosis and treatment planning to the licensed provider. Question 49. A 4-year-old female patient is brought to the clinic by her mother for a CBC and lead screening. The child is crying and extremely anxious, with small, difficult-to-access veins. The mother asks if the blood draw will hurt her daughter. You have determined that capillary puncture is appropriate for this patient. Which site and technique should you use to obtain the specimen while minimizing pain and ensuring adequate sample collection? Option A. Perform venipuncture in the antecubital fossa using a 23-gauge butterfly needle to ensure adequate blood flow and reduce procedure time. Option B. Perform capillary puncture on the lateral or medial plantar surface of the heel, warming the site for 3 to 5 minutes before puncture. Option C. Perform capillary puncture on the distal phalanx of the middle or ring finger, perpendicular to the fingerprint whorls, after warming the hand. Option D. Perform capillary puncture on the earlobe using a lancet, as this site is less painful and provides adequate blood for CBC testing. The correct answer is C. For children over 1 year of age, fingerstick capillary puncture is the preferred method. The distal phalanx of the middle or ring finger provides adequate blood flow, and puncturing perpendicular to the fingerprint whorls prevents blood from running along the ridges. Warming the site for 3 to 5 minutes increases blood flow up to 7 times, making collection easier and faster, which is especially important for anxious pediatric patients. Question 50. A medical assistant needs to enter the room of a patient on droplet precautions for suspected bacterial meningitis. Which PP items are required for this encounter? Option A. N95 respirator, gown, gloves. Option B. Surgical mask, gown, gloves. Option C. N95 respirator only, no gown or gloves required. Option D. Surgical mask only, gown and gloves are optional. The correct answer is B. Droplet precautions are used for pathogens transmitted via large respiratory droplets within 3 to 6 feet, e.g., bacterial meningitis, influenza, pertussis. A surgical mask provides adequate protection against droplet transmission. Gown and gloves are required as part of standard precautions combined with transmission-based precautions for contact with patient or environment. Question 51. A medical assistant needs to urgently communicate a patient's elevated blood pressure, 180/110 mmHg, with severe headache symptoms to the provider. Using SBAR format, which component should the medical assistant state first? Option A, I recommend the provider see this patient immediately. Option B, the patient reports a severe headache and has elevated blood pressure. Option C, I'm calling about Mrs. Johnson in room 3 who has a concerning vital sign. Option D, the patient's medical history includes hypertension and she takes lisinopril. The correct answer is C. SBAR stands for Situation, Background, Assessment, Recommendation. The first component is situation, which provides a brief, clear statement of the immediate issue. Stating who the patient is and what the concern is up front allows the provider to immediately understand the context and urgency of the communication. Question 52. A medical assistant is preparing to administer an oral medication to a 4-year-old child who is anxious and refusing to take the medicine. The child's parent is present in the room. Which of the following actions should the medical assistant take? Option A, tell the child they will get a shot if they don't take the medicine. Option B, restrain the child and administer the medication quickly. Option C, ask the parent to help calm the child and offer the medication in a small cup with a straw. Option D, crush the medication and mix it with a large bottle of juice without informing the parent. The correct answer is C. When administering medications to pediatric patients, involving the parent and using age-appropriate techniques helps reduce anxiety and improve cooperation. Offering medication with a straw in a small cup gives the child some control and makes administration easier. The parent's presence and assistance can provide comfort and reassurance to the child. Question 53. Which chamber of the heart receives oxygenated blood from the lungs and pumps it to the rest of the body? Option A, right atrium. Option B, right ventricle. Option C, left atrium. Option D, left ventricle. The correct answer is D. The left ventricle is the heart's main pumping chamber. It receives oxygenated blood from the left atrium, which receives blood from the lungs via the pulmonary veins, and pumps it through the aorta to deliver oxygen to all body tissues. The left ventricle has the thickest myocardium because it must generate enough pressure to propel blood throughout the systemic circulation. Question 54. A medical assistant works in an urgent care center. Which characteristic best describes the patient population and workflow in this type of ambulatory setting? Option A, patients with scheduled appointments for chronic disease management and follow-up visits. Option B, walk-in patients with acute, non-life-threatening conditions requiring rapid assessment. Option C, patients requiring surgical procedures with preoperative preparation and postoperative recovery. Option D, patients with life-threatening emergencies requiring immediate stabilization and ICU transfer. The correct answer is B. Urgent care centers are ambulatory settings designed for walk-in patients with acute but non-life-threatening conditions such as minor injuries, infections, sprains, and sudden illness. The workflow emphasizes rapid TRIA, efficient assessment, and timely treatment without requiring scheduled appointments. Patients with life-threatening emergencies are referred to emergency departments. Question 55. During a venipuncture, a medical assistant notices the patient's skin becoming pale and clammy. The patient reports feeling lightheaded. What should the medical assistant do first? Option A. Quickly complete the blood draw to minimize patient wait time. Option B. Remove the needle immediately and apply pressure to the site. Option C. Ask the patient to lie down while continuing the procedure. Option D. Call for the provider before taking any action. The correct answer is B. The patient is showing signs of syncope, fainting, which requires immediate intervention. The medical assistant should remove the needle first to prevent injury if the patient loses consciousness, then apply pressure to the puncture site, lower the patient's head, and monitor vital signs. Safety takes priority over completing the blood draw. Question 56. A medical assistant is preparing to draw blood for a stat potassium level and a CBC. If the medical assistant must use a winged collection device, butterfly needle, for this draw, which tube should be collected first? Option A, lavender tube. Option B, red/gold tube. Option C, light blue tube, even if not ordered. Option D, green tube. The correct answer is C. When using a butterfly needle, winged collection device, a small amount of air enters the tubing before blood fills the first tube. This air can cause a dead space volume that reduces the amount of blood entering the first tube, potentially affecting the additive-to-blood ratio in tubes with additives. To address this, a light blue discard tube should be drawn first, even if coagulation tests are not ordered, before collecting tubes with additives like EDTA lavender to ensure proper filling ratios for subsequent tubes. Question 57. You are preparing to perform venipuncture on a 45-year-old female patient who has a history of mastectomy on the left side with lymph node dissection 6 months ago. The patient also has an 4-line infusing normal saline in her right antecubital fossa and visible scarring from previous venipunctures on the dorsal aspect of her right hand. The patient's left arm has good venous access in the antecubital fossa with palpable median cubital and cephalic veins. Based on the patient's clinical presentation, which site should you select for venipuncture? Option A, left antecubital fossa, because it has the best venous access with palpable median cubital and cephalic veins. Option B, right dorsal hand veins, because they are distal to the foresite and the left arm is contraindicated due to mastectomy. Option C, right antecubital fossa above the foresite, because the veins are larger and drawing above the fore prevents dilution. Option D, left antecubital fossa, but only after turning off any fore fluids for 2 minutes before collection. The correct answer is B. Venipuncture is contraindicated on the same side as a mastectomy with lymph node dissection due to the risk of lymphedema, infection, and compromised lymphatic drainage. Since this patient had a left mastectomy, the left arm must be avoided regardless of vein quality. When N4 is present in the only available arm, venipuncture should be performed distal to, below, the foresite, never proximal, above, to prevent contamination of the specimen with fore fluids. The right dorsal hand veins, despite scarring, represent the safest option that follows proper contraindication guidelines. Question 58. While processing a patient's chart for an upcoming visit, the medical assistant sees the abbreviation SB documented in the chief complaint section. What condition should the assistant expect to see addressed during this appointment? Option A, shortness of breath. Option B, side of body. Option C, sick of breathing. Option D, significant obstruction block. The correct answer is A. SB is the standard medical abbreviation for shortness of breath, a common symptom documented in patient records. This abbreviation appears frequently in chief complaints, progress notes, and diagnostic coding. Medical assistants must recognize common abbreviations to accurately transcribe, code, and communicate patient information. Question 59. A medical assistant observes that a colleague did not properly label a urine specimen before leaving the collection room. The specimen was later sent to the laboratory. Which of the following is the most appropriate action for the medical assistant to take? Option A. Ignore the incident to avoid creating conflict with the colleague. Option B. Correct the label immediately without reporting the incident. Option C. Report the incident through the clinic's incident reporting system. Option D. Verbally reprimand the colleague in front of other staff members. The correct answer is C. Incident reporting systems exist to capture errors, near misses, and process failures for quality improvement and patient safety analysis. Proper specimen labeling is a chain of custody requirement. Unlabeled specimens risk misidentification and incorrect results. Reporting enables root cause analysis and system-wide improvements, not punishment. Question 60. A patient whose spouse recently passed away says, "This can't be happening. I keep expecting her to walk through the door." According to Kubler-Ross's stages of grief, which stage is this patient experiencing? Option A, anger. Option B, bargaining. Option C, denial. Option D, depression. The correct answer is C. The Kubler-Ross model identifies denial as the first stage of grief, characterized by refusal to accept the reality of the loss. Statements such as "this can't be happening" or "expecting the deceased person to return" are classic expressions of denial. This stage serves as a protective mechanism that helps the individual absorb the news gradually. Question 61. A medical assistant is part of a quality improvement initiative to improve diabetes care outcomes in the clinic. The team is implementing a registry-based approach to track patients with diabetes. Which data elements should the medical assistant ensure are accurately documented and updated in the diabetes registry for each patient? Option A, patient name, date of birth, insurance information, and last appointment date. Option B, most recent HbA1c, blood pressure readings, medication list, foot exam dates, eye exam dates, and preventive care gaps. Option C, chief complaint, vital signs from every visit, and provider notes. Option D, number of appointments kept versus no-shows and patient satisfaction scores. The correct answer is B. Disease registries for chronic conditions like diabetes track clinical quality metrics and preventive care gaps. Key data elements include HbA1c, glycemic control, blood pressure, cardiovascular risk, medications, adherence and appropriateness, and dates of required preventive services, annual foot exams, dilated eye exams, renal function monitoring. This data enables proactive outreach and quality measurement. Question 62. A patient sends a message through the patient portal asking for medical advice about new symptoms. "I've had chest pain for 2 days. Should I take aspirin or just rest?" The medical assistant sees the message during routine portal monitoring. What is the most appropriate response? Option A, reply through the portal advising the patient to take aspirin and rest, then document the exchange. Option B, reply through the portal telling the patient to come to the clinic tomorrow for evaluation. Option C, immediately notify the provider about the message and follow office protocol for urgent symptom triage. Option D, call the patient directly to gather more information before determining next steps. The correct answer is C. Chest pain is a potentially urgent symptom that requires provider evaluation and falls outside the medical assistant's scope of practice for independent advice. The appropriate action is to escalate immediately to the provider and follow established triage protocols, which may include directing the patient to urgent care or the emergency department. Medical assistants should not provide medical advice, especially for symptoms that could indicate serious conditions like myocardial infarction. Timely escalation is critical for patient safety. Question 63. A 67-year-old male patient with limited English proficiency and an 8th grade education level has been instructed by the provider to start taking metformin 500 milligrams twice daily with meals for his diabetes. The provider asks the medical assistant to ensure the patient understands the instructions before checkout. The patient nods and says yes when asked if he understands. Which action best verifies the patient's comprehension using the teachback method? Option A. Ask the patient to sign a form acknowledging that he received and understands his medication instructions. Option B. Provide written instructions in the patient's primary language and ask if he has any questions. Option C. Ask the patient to explain in his own words how he will take his new medication and when. Option D. Call the patient's family member to come back and review the medication instructions together. The correct answer is C. The teachback method requires asking patients to explain information in their own words, which allows the medical assistant to identify gaps in understanding. A simple yes response does not verify comprehension, especially with language barriers or low health literacy. This approach respects patient autonomy while ensuring safety and adherence. Question 64. A patient asks the medical assistant to explain their insurance plan's out-of-pocket maximum. Which of the following is the correct definition? Option A. The maximum amount the insurance company will pay for any single medical procedure. Option B. The total amount the patient pays in premiums over the course of a year. Option C. The limit on the patient's total costs for covered services during a plan year, after which the insurance pays 100% of covered services. Option D. The maximum deductible amount the patient must pay before insurance coverage begins. The correct answer is C. The out-of-pocket maximum is the total limit on what a patient pays for covered services during a plan year, including deductibles, copays, and coinsurance. Once the patient reaches this maximum, the insurance plan pays 100% of covered services for the remainder of the plan year. This is an important insurance concept that medical assistants must understand to explain patient financial responsibilities. Question 65. Which component of the lymphatic system filters lymph, removes pathogens, and contains immune cells that respond to infections? Option A. Lymph vessels. Option B. Lymph nodes. Option C. Thymus. Option D. Spleen. The correct answer is B. Lymph nodes are small, bean-shaped organs distributed throughout the body along lymphatic vessels. They filter lymph fluid as it passes through, trapping bacteria, viruses, and other pathogens. Lymph nodes contain lymphocytes and macrophages that mount immune responses against trapped pathogens. Swollen lymph nodes during infection indicate active immune cell proliferation within the node. Question 66. A medical assistant is scheduling a referral for a patient with a diagnosis of nephrolithiasis. Based on the word parts in this term, which specialist type should the referral most likely be directed to? Option A. Neurologist, kidney specialist. Option B. Nephrologist, kidney specialist. Option C. Urologist, urinary system specialist. Option D. Gastrologist, digestive system specialist. The correct answer is B. The term nephrolithiasis breaks down as follows: nephro, word root for kidney, plus lith, stone, plus yasha's condition. The presence of nephro indicates the kidney is the primary organ involved. A nephrologist specializes in kidney diseases and would be appropriate for managing kidney stone conditions requiring medical management. Question 67. During a sterile procedure, the medical assistant observes that the provider's sterile glove has touched the non-sterile forepole. Which action should the medical assistant take first? Option A. Notify the provider immediately about the contamination. Option B. Offer the provider a new sterile glove from the supply table. Option C. Document the break in sterile technique after the procedure. Option D. Continue assisting and address the issue when the procedure ends. The correct answer is A. When a break in sterile technique is observed, the medical assistant must notify the provider immediately. Any delay could result in the contaminated glove touching additional sterile items or the patient's wound, potentially causing a surgical site infection. Immediate notification allows the provider to replace the glove before continuing, maintaining patient safety. This reflects the medical assistant's responsibility to monitor sterile technique throughout the procedure and communicate any breaches promptly. Question 68. After a minor surgical procedure is completed, the medical assistant is responsible for post-procedure cleanup. Which sequence represents the correct order for processing contaminated instruments? Option A. Sterilize, package, clean, disinfect. Option B. Clean, disinfect, package, sterilize. Option C. Disinfect, clean, sterilize, package. Option D. Package, sterilize, clean, disinfect. The correct answer is B. Instrument processing follows a specific sequence to ensure proper sterilization. First, instruments must be cleaned to remove visible debris, blood, and tissue using enzymatic cleaners and manual or ultrasonic cleaning. Second, disinfection may occur, depending on the process, to reduce microbial load. Third, instruments are packaged in sterilization pouches or wraps. Finally, sterilization occurs in the autoclave. Sterilization cannot be effective if instruments are not first cleaned, as organic material can shield microorganisms from the sterilization process. Question 69. A medical assistant is preparing to perform a venipuncture on a patient scheduled for comprehensive blood work, including a complete blood count, CBC, comprehensive metabolic panel, CMP, and lipid panel. Upon checking the supply cabinet, the MA discovers that lavender top tubes, EDTA, are below the par level and only 2 tubes remain in stock. The gray top tubes for glucose testing are also depleted. The office follows a par level inventory system where supplies are reordered when stock reaches a predetermined minimum threshold. The laboratory pickup is scheduled in 2 hours. Which of the following actions should the medical assistant take first? Option A. Proceed with the blood draw using only the available tubes and document that insufficient supplies prevented collection of all ordered tests. Option B. Immediately notify the office manager about the depleted supplies and request an urgent supply order before attempting the venipuncture. Option C. Check the supply inventory log to verify whether a reorder was already triggered when supplies reached par level, then check with the office manager on order status. Option D. Reschedule the patient for next week when supplies will be replenished. The correct answer is C. Par-level inventory systems are designed to trigger reorders automatically or manually when supplies reach minimum thresholds. The medical assistant should first verify the inventory management system status to determine if supplies were already ordered and when they will arrive. This informs whether the patient draw can be completed today or requires rescheduling. Understanding the order status prevents unnecessary rescheduling if supplies are arriving soon. Question 70. A medical assistant obtains a 12-lead EKG tracing that shows a wandering, unstable baseline. After checking the machine, what patient-related cause should the medical assistant first investigate? Option A. patient movement or muscle tension. Option B, electrode placement accuracy. Option C, electrical interference from nearby equipment. Option D, patient's cardiac rhythm abnormality. The correct answer is A. Baseline wander is most commonly caused by patient movement, breathing, or muscle tension. The medical assistant should first assess whether the patient is relaxed, lying still, and breathing normally. Addressing patient positioning and relaxation often resolves baseline wander before investigating other causes. Question 71. A medical assistant is caring for a 4-year-old child who needs a pain assessment following a minor injury. The child is verbal but has difficulty expressing the intensity of pain. Which pain assessment scale is most appropriate for this patient? Option A, numeric rating scale, 0 to 10. Option B, visual analog scale, VS. Option C, Wong-Baker Faces pain scale. Option D, Flack behavioral pain scale. The correct answer is C. The Wong-Baker Faces pain scale is specifically designed for children ages 3 and older who are verbal but may have difficulty quantifying pain numerically. It uses 6 faces ranging from happy, no pain, to crying, worst pain, allowing children to point to the face that matches how they feel. This scale is age-appropriate and validated for pediatric pain assessment in clinical settings. Question 72. A medical assistant is preparing a patient for EKG who has a right arm amputation. Where should the RA right arm electrode be placed? Option A, skip the RA electrode and continue with the remaining leads. Option B, place the RA electrode on the right side of the chest near the clavicle. Option C, place the RA electrode on the residual limb at the end of the stump. Option D, place the RA electrode on the right leg to maintain limb lead symmetry. The correct answer is B. For patients with upper limb amputations, the arm electrodes should be placed on the torso at approximately the same distance from the heart as the standard wrist placement would be. The RA electrode should be placed on the right side of the chest near the clavicle or upper torso to maintain proper electrical relationships for limb lead formation. Question 73. Which of the following is the proper sequence for skin preparation before applying EKG electrodes? Option A, apply electrodes, then clean skin with alcohol. Option B, clean skin with alcohol, shave if needed, let dry, then apply electrodes. Option C, shave skin, apply electrodes, then clean with alcohol. Option D, clean skin with alcohol, apply electrodes immediately while skin is wet. The correct answer is B. Proper skin preparation for EKG electrodes involves cleaning the skin with alcohol to remove oils and dirt, shaving the site if hair is present that would interfere with electrode adhesion, allowing the skin to dry completely. Alcohol residue can interfere with electrode adhesive and signal quality, and then applying the electrodes. This sequence ensures optimal electrode contact and minimizes artifact. Question 74. A medical assistant is assisting with a minor surgical procedure in an outpatient clinic. The provider has requested additional sterile supplies mid-procedure. The medical assistant approaches the sterile field to add supplies. Which of the following actions maintains the integrity of the sterile field during supply addition? Option A, open the sterile package and drop the supplies onto the sterile field from a height of at least 12 inches. Option B, open the sterile package, reach across the sterile field, and place the supplies directly where needed. Option C, open the sterile package and hand the supplies to the provider, who places them on the field. Option D, open the sterile package onto the edge of the sterile drape, then slide the supplies onto the field. The correct answer is A. When adding supplies to a sterile field, the medical assistant should open the sterile package and drop the supplies onto the sterile field from a height of at least 12 inches without reaching over or touching the sterile field. This technique prevents contamination by avoiding contact with sterile surfaces and maintaining distance from the field. Question 75. Which additive is found in a lavender, purple, top blood collection tube? Option A, sodium citrate. Option B, heparin. Option C, EDTA, ethylenediamine tetracic acid. Option D, sodium fluoride. The correct answer is C. The lavender, purple, top tube contains EDTA, which acts as an anticoagulant by binding calcium and preventing blood from clotting. EDTA tubes are primarily used for hematology tests such as complete blood counts, CBC, blood smears, and erythrocyte sedimentation rate, ESR. EDTA preserves cell morphology better than other anticoagulants, making it the preferred choice for hematologic analysis. Question 76. Which medical abbreviation indicates that a medication should be taken as needed and is commonly found in prescription orders and medication documentation? Option A, QD. Option B, PRN. Option C, STAT. Option D, AC. The correct answer is B. PRN stands for pro re nata, Latin for as needed or as the situation arises. This abbreviation is standard in prescription orders, indicating that a medication should be taken only when symptoms occur, rather than on a fixed schedule. Medical assistants encounter PRN frequently in medication reconciliation and documentation. Question 77. A medical assistant is scheduling appointments in a clinic that uses modified wave scheduling. The provider sees patients in 15-minute time slots. At 9 a.m., 3 patients are scheduled, and at 9:15 a.m., 1 patient is scheduled. A new patient calls requesting an urgent same-day appointment for a minor illness. What is the most appropriate scheduling action? Option A, tell the patient no same-day appointments are available and schedule for next week. Option B, schedule the patient at 9:30 a.m., continuing the modified wave pattern. Option C, add the patient to the 9 a.m. slot as a 4th patient in the wave. Option D, schedule the patient during the buffer time typically built into modified wave scheduling. The correct answer is D. Modified wave scheduling intentionally builds in buffer time or open slots to accommodate urgent visits, no-shows, and overflows. This flexibility is the advantage of modified wave over standard wave scheduling. The medical assistant should utilize this buffer time for the urgent same-day appointment. Question 78. An automated external defibrillator, AD, has been brought to a patient who collapsed and is unresponsive. After attaching the AED pads, the device analyzes the rhythm and advises that a shock is indicated. Which action should the medical assistant take immediately before pressing the shock button? Option A, continue chest compressions while the shock is delivered. Option B, ensure no one is touching the patient and loudly announce, clear. Option C, check the patient's pulse again to confirm cardiac arrest. Option D, remove the AED pads and wait for EMS to arrive. The correct answer is B. Before delivering a shock with an AD, the rescuer must ensure that no one is in physical contact with the patient. The electrical shock can transfer to anyone touching the patient, causing injury or disrupting the intended therapy. The standard protocol is to visually confirm the area is clear, loudly announce clear or stand clear, and then press the shock button only after confirming no contact. Question 79. Which type of muscle tissue is found in the walls of the heart and contracts involuntarily to pump blood? Option A, skeletal muscle. Option B, smooth muscle. Option C, cardiac muscle. Option D, striated muscle. The correct answer is C. Cardiac muscle, myocardium, is a specialized type of muscle tissue found exclusively in the heart walls. It is striated like skeletal muscle, but operates involuntarily like smooth muscle. Cardiac muscle cells are interconnected by intercalated discs, allowing coordinated contraction of the entire heart. This tissue cannot be consciously controlled and continuously contracts throughout life. Question 80. A medical assistant experiences a needlestick injury while disposing of a used phlebotomy needle. The needle had been used to draw blood from a patient whose hepatitis B status is unknown. According to OSHA's bloodborne pathogen standard, what is the first action the medical assistant must take? Option A, report the incident to the supervisor immediately. Option B, wash the wound with soap and water. Option C, complete an incident report form. Option D, seek medical evaluation at the emergency department. The correct answer is B. Immediate wound care is the first priority following any sharps injury. OSHA's bloodborne pathogen standard requires that the exposed employee immediately wash the wound site with soap and water, or flush mucous membranes with water, to reduce the risk of pathogen transmission. After immediate wound care, the employee must then report the incident to the supervisor, complete documentation, and seek medical evaluation for post-exposure prophylaxis consideration. However, prompt wound cleansing is the critical first step to minimize infection risk. Question 81. A medical assistant is preparing instruments for sterilization in the autoclave after a minor surgical procedure. The instruments include a contaminated scalpel handle, forceps, and scissors. Which step must occur before placing the instruments in the autoclave sterilization pouches? Option A, apply sterilization indicator tape to each instrument individually. Option B, decontaminate and clean the instruments thoroughly to remove visible debris. Option C, place all instruments directly into autoclave pouches without pre-processing. Option D, soak instruments in a bleach solution for 30 minutes before autoclaving. The correct answer is B. Autoclave sterilization cannot penetrate through organic debris, blood, or tissue residue. Instruments must first undergo decontamination, soaking in an enzymatic solution or disinfectant, followed by thorough cleaning to remove all visible organic material before being placed in sterilization pouches. Sterilization indicators are applied to the pouches after cleaning, not directly to contaminated instruments. Question 82. A medical assistant is preparing a patient for a 12-lead EKG. The patient has hairy chest areas where the electrodes need to be placed. Which action should the medical assistant take to ensure proper electrode adhesion? Option A, apply additional electrodes over the existing hair. Option B, shave the areas where electrodes will be placed. Option C, apply the electrodes on nearby hairless areas instead. Option D, use extra electrode gel to improve conductivity through hair. The correct answer is B. Proper skin preparation is essential for electrode adhesion and signal quality. Shaving hair at electrode placement sites ensures direct skin contact, reduces artifact, and improves tracing quality. This is standard practice before EKG electrode application and should be performed with the patient's consent and proper technique. Question 83. A medical assistant has collected multiple specimens from a patient and placed them in a biohazard transport bag. Which additional documentation must accompany the specimens for proper chain of custody during transport? Option A written statement from the patient confirming specimen collection. Option B, a requisition form listing all tests ordered with patient and collector information. Option C, a photograph of the specimen tubes with visible labels. Option D, a signature from the laboratory supervisor authorizing specimen acceptance. The correct answer is B. A requisition form is required documentation that accompanies specimens during transport. It must include patient identification information, tests ordered, collection date and time, and collector identification. This document serves as the link between the specimen and the clinical order, ensuring that laboratory personnel can verify specimen purpose and patient identity upon receipt. Question 84. A medical assistant is rooming a 72-year-old patient with multiple chronic conditions including diabetes, hypertension, and chronic kidney disease. The patient's vital signs show blood pressure 145/92 mmHg, pulse 88 bpm, and capillary blood glucose 245 mg per deciliter. The medical assistant documents the findings and then needs to communicate this information to the provider, who is currently in another exam room. Which communication approach is most appropriate? Option A, wait until the provider finishes with the current patient, then casually mention the vital signs during the examination. Option B, send an instant message through the EHR system with the vital signs and wait for a response. Option C, use SBAR format to briefly and clearly communicate the key findings, including the elevated glucose, when briefly interrupting the provider. Option D, leave a note on the provider's desk and assume they will read it before entering the patient's room. The correct answer is C. SBAR, situation, background, assessment, recommendation, provides a structured, efficient way to communicate clinical findings. The elevated blood glucose, 245 mg per deciliter, in a diabetic patient with CKD is clinically significant and warrants timely provider awareness. Brief, structured communication allows the provider to prioritize and prepare for appropriate intervention. Question 85. A patient is diagnosed with chronic kidney disease. Which functional unit of the kidney is damaged, leading to impaired filtration of blood and waste product accumulation? Option A, renal pelvis. Option B, ureter. Option C, nephron. Option D, bladder. The correct answer is C. The nephron is the functional unit of the kidney responsible for filtering blood and forming urine. Each kidney contains approximately 1 million nephrons. Each nephron consists of a glomerulus, where filtration occurs, and a tubule, where filtration fluid is modified to form urine. Chronic kidney disease involves progressive damage to nephrons, reducing the kidney's ability to filter waste products from blood and regulate fluid and electrolyte balance. Question 86. A medical assistant is selecting equipment for a venipuncture on an elderly patient with fragile veins and a history of difficult draws. The patient requires collection of 3 tubes for various laboratory tests. Which equipment selection is most appropriate for this patient? Option A, standard evacuated tube system with 21-gauge needle. Option B, butterfly needle, 23-gauge, with evacuated tube adapter. Option C, syringe draw using a 25-gauge needle and transfer device. Option D, standard evacuated tube system with 18-gauge needle. The correct answer is B. Elderly patients with fragile veins often require smaller gauge needles to reduce vein trauma and collapse risk. A butterfly needle, 23 gauge, provides flexibility for accessing difficult veins, allows better control of needle angle, and reduces the risk of vein injury. The butterfly system with an evacuated tube adapter permits collection of multiple tubes. A 21-gauge standard needle may be too large for fragile veins, while 18-gauge is inappropriate. A syringe draw with 25-gauge is possible, but less efficient for multi-tube collection. Question 87. A medical assistant notes that the autoclave temperature indicator shows 240 degrees Fahrenheit instead of the required 250 degrees Fahrenheit during a sterilization cycle. What is the most appropriate action to take? Option A. Allow the cycle to complete and document the discrepancy. Option B. Increase the cycle duration by 15 minutes to compensate. Option C. Stop the cycle and notify the supervisor or maintenance personnel. Option D. Remove the instruments and repackage them for the next cycle. The correct answer is C. Autoclave sterilization requires a minimum temperature of 250 degrees Fahrenheit 121 degrees Celsius at 15 psi for 15 to 30 minutes to achieve proper sterilization. If the temperature indicator shows a lower value, sterilization cannot be confirmed and instruments are not safe for patient use. The cycle must be stopped and equipment malfunction must be reported immediately. Question 88. A provider orders the following tests for a patient: lactic acid, PT/INR, and CBC. In which order should the medical assistant collect the tubes? Option A, gray tube, light blue tube, lavender tube. Option B, light blue tube, gray tube, lavender tube. Option C, light blue tube, lavender tube, gray tube. Option D, lavender tube, light blue tube, gray tube. The correct answer is B. Following the standard order of draw, light blue tubes, for coagulation tests like PT/INR, are drawn after blood cultures, but before other additive tubes. Gray tubes contain sodium fluoride and are drawn after light blue and red/gold tubes. Lavender tubes, EDTA, are drawn after green tubes. Since no blood cultures, red/gold tubes, or green tubes are ordered, the sequence is light blue first, gray second, lavender third. This prevents additive carryover that could affect test accuracy. Question 89. A medical assistant is preparing to call a provider using SBAR format. The patient is a 68-year-old male with a history of COPD who is experiencing increased shortness of breath. Which information should be included in the background section? Option A. I think we should order a chest X-ray. Option B. Mr. Davis has COPD, takes albuterol inhaler, and his O2 saturation is 88% on room air. Option C. I'm calling about Mr. Davis, who is having trouble breathing. Option D. Can you come see him or order any tests? The correct answer is B. The background section of SBAR includes relevant patient history, current medications, vital signs, and objective data that provide context for the situation. This information helps the provider understand the patient's baseline and current status. Including the COPD history, medication, and oxygen saturation gives essential clinical context. Question 90. A medical assistant is preparing to remove sutures from a patient's forearm laceration that was repaired 10 days ago. Before beginning the procedure, what should the medical assistant do first? Option A. Apply antibiotic ointment to the suture line. Option B. Clean the suture line with antiseptic solution. Option C. Verify the provider's order for suture removal. Option D. Explain the procedure to the patient. The correct answer is C. Verifying the provider's order is the first step in the 6 rights of medication administration and procedural safety. This ensures the correct procedure is being performed at the appropriate time and prevents premature suture removal that could compromise wound healing. Question 91. A medical assistant is preparing a 52-year-old female patient for an abdominal examination. The patient has a history of anxiety related to medical examinations and mentions feeling nervous about being examined. The provider will be palpating the abdomen and assessing for possible gallbladder disease. The examination room temperature is slightly cool. Which of the following actions by the medical assistant demonstrates best practice for patient preparation? Option A. Ask the patient to lie flat in the supine position without any covering, explain that the examination will be quick, and leave the room immediately to reduce the patient's embarrassment. Option B. Position the patient in semi-Fowler's position with knees slightly bent. Provide a warm blanket for comfort and modesty draping. Explain each step of the examination in simple terms, and stay present to offer reassurance during the exam. Option C. Have the patient stand upright for better abdominal visualization. Skip any explanation since the provider will explain the procedure, and place a small towel over the patient's midsection. Option D. Position the patient in the prone position face down, cover her completely with multiple blankets to address anxiety, and ask her to relax without providing any specific examination information. The correct answer is B. Best practice for patient preparation addresses physical positioning, comfort, psychological needs, and communication. Semi-Fowler's position with knees bent relaxes abdominal muscles and facilitates palpation. A warm blanket addresses both the cool room temperature and patient comfort while providing modesty draping. Clear, simple explanation reduces anxiety by helping the patient understand what will happen. Staying present during the examination allows the medical assistant to provide ongoing reassurance and assist the provider while supporting the anxious patient. This comprehensive approach integrates clinical, comfort, and communication best practices. Question 92. A medical assistant is preparing a 42-year-old female patient for a pelvic examination. The provider has requested that the patient be positioned to allow optimal visualization of the vaginal canal and cervix. Which of the following positions should the medical assistant assist the patient into? Option A. Sims position. Option B. Lithotomy position. Option C. Trendelenburg position. Option D. Knee chest position. The correct answer is B. The lithotomy position is the standard position for pelvic examinations, allowing optimal visualization and access to the vaginal canal and cervix. In this position, the patient lies supine with hips and knees flexed, thighs abducted, and feet supported in stirrups. This position provides the provider with optimal access while maintaining patient comfort and modesty through proper draping. Question 93. A patient presents for an office visit, and their insurance card indicates a $30 copay. The patient states they do not have cash or a credit card available today. Which of the following is the most appropriate action for the medical assistant to take? Option A. Waive the copay and allow the patient to receive services without payment. Option B. Ask the patient to sign a payment agreement and collect the copay at a later date. Option C. Refuse to provide services until the patient can pay the copay in full. Option D. Reduce the copay amount to an amount the patient can afford today. The correct answer is B. Medical offices typically have policies for handling patients who cannot pay at the time of service. The appropriate action is to document the patient's financial responsibility through a payment agreement, which creates a formal record of the owed amount and establishes a plan for future collection. This balances patient access to care with the practice's financial needs while maintaining proper accounts receivable documentation. Question 94. A 45-year-old male patient returns to the clinic 10 days after a minor surgical procedure on his left forearm. The provider orders suture removal. Upon examination, the medical assistant observes that the wound edges are well approximated, there is no redness, swelling, or drainage, and the patient reports minimal discomfort. The sutures are non-absorbable simple interrupted sutures. Which of the following is the correct procedure for suture removal? Option A. Cut each suture on the patient side and pull the knot through the wound. Option B. Cut each suture on the knot side and pull the suture through from the patient side. Option C. Cut both sides of each suture and gently lift the entire suture out. Option D. Cut the suture in the middle and pull both ends simultaneously. The correct answer is B. The correct technique for suture removal is to cut the suture on the side away from the wound, knot side, and pull the suture through from the patient side. This prevents dragging the contaminated external portion of the suture through the healing wound tissue, reducing infection risk. The wound appears healed with no signs of infection, indicating it is ready for suture removal. Question 95. A medical assistant has collected a blood specimen in a light blue top tube for a coagulation test, PT/INR. Which of the following handling procedures should be followed to ensure accurate test results? Option A. Refrigerate the specimen immediately and transport within 24 hours. Option B. Keep the specimen at room temperature and centrifuge within 1 hour of collection. Option C. Allow the specimen to clot completely before centrifuging. Option D. Transport the whole blood specimen without centrifugation for immediate testing. The correct answer is B. Light blue top tubes, sodium citrate, for coagulation testing requires specific handling. The specimen should remain at room temperature, be centrifuged within 1 hour of collection to separate plasma, and the plasma should be tested within 4 hours. Refrigeration of whole blood coagulation specimens can alter results, and delayed centrifugation affects coagulation factor stability. Question 96. A medical assistant is preparing to perform venipuncture on a patient who has an 4-line in the left antecubital fossa. Which action is most appropriate? Option A. Perform venipuncture below the foresight on the same arm. Option B. Perform venipuncture above the foresight on the same arm. Option C. Select a vein on the opposite arm for venipuncture. Option D. Turn off the 4 for 5 minutes, then draw from the same arm. The correct answer is C. When a patient has an 4-line in place, venipuncture should be performed on the opposite arm whenever possible. Drawing blood from the same arm as an 4 can contaminate the specimen with 4 fluids, leading to inaccurate test results. The opposite arm provides the safest and most reliable specimen collection site. Question 97. An 82-year-old patient with dementia presents with a fractured wrist. Her daughter, who is her caregiver, states the patient fell while trying to walk alone. The patient cannot clearly explain what happened due to cognitive impairment. The medical assistant notices the patient appears withdrawn and has poor hygiene. Which of the following is the most appropriate action? Option A. Document the injury and allow the provider to determine if reporting is necessary. Option B. Report suspected elder abuse to Adult Protective Services or designated state agency. Option C. Question the daughter extensively to determine the truth before reporting. Option D. Discharge the patient with home care instructions since falls are common in elderly patients. The correct answer is B. Elder abuse mandatory reporting applies when healthcare professionals suspect physical abuse, neglect, or exploitation of vulnerable adults. Warning signs include unexplained injuries, poor hygiene, withdrawal, and caregiver explanations that may not match the injury pattern. The duty to report is triggered by reasonable suspicion, not investigation or confirmation. Question 98. A medical assistant is preparing to clean a room after a patient with active tuberculosis was seen. The patient was coughing throughout the visit. Which personal protective equipment, PP, should the medical assistant don before entering the room to clean? Option A, gloves only, as standard precautions are sufficient. Option B, gloves, gown, and surgical mask. Option C, gloves and an N95 respirator. Option D, gloves, gown, face shield, and surgical mask. The correct answer is C. Tuberculosis is an airborne disease requiring airborne precautions. When entering a room occupied by a patient with known or suspected active TB, or when cleaning such a room shortly after the patient has left, healthcare workers must wear an N95 respirator or higher-level respirator to protect against airborne transmission. Gloves are also required for environmental cleaning to protect against potential contact with contaminated surfaces. Standard precautions alone are insufficient for airborne pathogens. Question 99. According to CDC guidelines, which type of transmission-based precautions should be implemented for a patient diagnosed with active tuberculosis? Option A, contact precautions. Option B, droplet precautions. Option C, airborne precautions. Option D, protective isolation. The correct answer is C. Tuberculosis is caused by Mycobacterium tuberculosis, which is transmitted through airborne particles that can remain suspended in the air for extended periods and travel long distances. Airborne precautions require a negative pressure isolation room, AIR, and use of N95 respirators or higher-level respiratory protection. This differs from droplet transmission, which involves larger particles that travel short distances. Question 100. A medical assistant is reviewing a 45-year-old patient's chart before an annual wellness visit. According to preventive care guidelines, which screening should the medical assistant anticipate the provider will order for this patient? Option A, mammogram referral for female patients. Option B, colonoscopy screening. Option C, bone density scan. Option D, vision screening for glaucoma. The correct answer is A. According to USPSTF guidelines, women aged 40 to 74 should receive regular screening mammograms for breast cancer. A 45-year-old female patient would be due for this screening. Colonoscopy typically begins at age 45 to 50, bone density scans are recommended starting at age 65 for women, and glaucoma screening is typically for patients over 60 or with risk factors.